Well, I'm going to start with a word of welcome. So thank you all for being here for today's event on addressing homelessness. If we haven't met before, my name is Kate DeConnick. I teach in the Department of Theology and Religious Studies at the University of San Diego. And along with Dr. Mike Williams, I'm also the co-director of this group known as the Urgent Challenges Collective. So the collective, if you haven't heard of it before, is this initiative at USD that supports research, teaching, and advocacy and community engagement on the issue of homelessness here in San Diego. And if you're attending today, it's probably because you have a sense of how important this issue and working to address it in our local community actually is. So today's event is hosted by the collective, and it is also part of our third annual Homelessness Action Week at the University of San Diego. So the Action Week is meant to provide opportunities for students, faculty, staff members, but also our community partners and neighbors to come together to learn more about the issue of homelessness and also to get more involved in helping to address this issue. So we are in the middle of this week-long series of programs, and this is one event as part of that sequence. I will put the full schedule for the program in the chat in just a few minutes in case you haven't had a chance to see the full schedule. So first of all, we're thrilled to see such great turnout for today's event. As we are getting going, we would love it if those of you who are in attendance could introduce yourselves in the chat. I'm going to put a little prompt in there for you if you're able to participate. We would just love to hear, what's your name? What's your affiliation? Are you a USD student or an affiliate at a local nonprofit, or what's your role? And then lastly, what drew you to today's event? Is there something in particular you're hoping we're going to talk about, or do you have a question? Anything that you'd like to share would just be helpful as we're thinking about who's in the room with us today and getting you connected with one another as well. So in just a second, I'm going to turn the mic over to Dr. Williams, who will introduce today's wonderful speaker. Before I do that, I just wanted to share a couple of kind of logistical notes about the framing for how we're going to run today's session. So first of all, we're going to have a pretty big group. I think we had about 50 people who are registered to attend today. So with that in mind, I see that most of you or all of you right now are muted. We appreciate that. It is helpful if when people are not speaking, they keep their mics muted so we can avoid any distracting background noise. The other thing that we wanted to mention at the start is that at the kind of later portion of today's event, we're going to have some time for questions and answers. So you have the opportunity to submit questions to pose to our speaker. The way that we're going to facilitate that is in just a minute. I'm going to share in the chat, and I'll share a few times throughout today's event, the link to a Google document. And this document you can open up and you can type questions directly into the link there. And we're going to pick some of the questions off of that document to pose to our guest for today as part of our conversation with her. Okay, so I'm going to drop that in the chat right now, and you're welcome to open it up. If someone else poses a question that you are really interested in, you are welcome to put a little star next to that, and that way we'll know that there's a lot of interest in that particular question. But with that, I'm going to turn things over to Dr. Williams, and he's going to go on from here.
Yeah, thanks, Dr. DeConnick. And as Dr. DeConnick mentioned, my name is Mike Williams, and I'm the co-director of the Urgent Challenges Collective with her. I'm also a professor in the Department of Political Science and International Relations, and I'm the director of the Changemaker Hub. But today, my important role is to introduce our honored guest, Ms. Hafsa Kaka. We are really thrilled that she could join us today. Since August, Ms. Kaka has been the director of the Homelessness Strategies and Solutions Department in the city of San Diego. This is a brand new department created this year by Mayor Gloria and the San Diego City Council. Ms. Kaka holds a bachelor's degree in psychology and social behavior and criminology, law and society from UC Irvine. She also holds a master's degree in social work from the University of Minnesota. For the past 15 years, Ms. Kaka has been working to find solutions to homelessness in other Southern California cities. She brings to this position not only a wealth of experience and knowledge about the issue, but also a commitment to find solutions that are compassionate as well as effective. And with that, I'm going to turn the Zoom space over to Ms. Kaka. Thank you again for joining us today.
Of course. Thank you so much, Dr. Williams and Kate. And first and foremost, to your initiation of having such an important topic to be presented, and also this wonderful week where you're highlighting the importance of homelessness, not only locally, but also as it is a pandemic throughout our nation. And throughout the world, no one person should be unhoused. It is a human right. Thank you for the wonderful introduction. I'm honored to be here, and I'm honored to be the new director of Homelessness Strategies and Solutions with Mayor Gloria's office. I'll go ahead and start out and give a little bit of experience that I have in terms of my experience in Southern California. And then also then go on to talk a little bit about what we are looking and focusing at in this administration in San Diego, and then happy to take any questions. So some of the things that I have been able to lead in Los Angeles County and be part of, where I began the homeless services. I've always been in social work and human services with the background that you highlighted. But some of the things in LA that I had seen is I got an opportunity to work in Skid Row, the heart of the nation's pandemic. And it is just, you see everything there. It's a biopsychosocial awareness of human complexities, of persons experiencing homelessness, experiencing mental health, substance abuse, criminal justice system, the list goes on. It's interesting that those issues are not just obviously in one concentrated area, but it's all throughout. And I see it here as well. But in LA, I was able to really help lead a very important policy, being part of Los Angeles Homeless Services Authority, which is the largest continuum of care. Continuum of Care is a body that receives the HUD, Housing Urban Development funding, for the continuation of local dollars to address homelessness, including shelter, which is the Emergency Solutions Grant, the Homeless Management Information System. Yes, there is a Homeless Management Information System to help track persons experiencing homelessness and their needs and programs. And then lastly, along with systems coordination is also the point in time count that the Continuum of Cares. And if you are not sure what the point in time count, it is basically a point in time count, typically in January, where jurisdictions go out early in the morning to count persons experiencing homelessness to better inform the local delineation of funds and outcomes. So in LA, I was able to help with the Measure H and Triple H initiative, where it was a quarter sales tax to help sustainable funding for supportive services and affordable housing development. So that was very exciting, and had an opportunity to work in service planning area all the way from the Antelope Valley to Long Beach to Culver City to Skid Row. So that really gave me a good foundation of understanding how the system works. We think that homelessness could be easy, right? It's taking a person who's unhoused and providing them housing. But there's so many pieces to that puzzle. And then I had the honor to work in Orange County in Santa Ana, the county seat, and really work on a regional collaborative to address homelessness. Orange County historically did not have regional equity in terms of all the cities and the county coming together. And so it was happened to work with Federal Judge Carter on the litigious environment of bringing folks and cities and board of supervisors and city councils and folks together to help establish political will and creating programs and services. And one of the things I led was a 200-bed shelter in just 28 days that was able to serve all populations. And then in Riverside, I did have an opportunity to work during the COVID pandemic. So it was very interesting to see how we were able to lead a non-congregate shelter through the small pallet communities, or as they call it, the TEF sheds. I think sometimes there is a misunderstanding that that's not the best, but it could actually be a great environment for persons experiencing homelessness if they want their own space. Not to say that that works for every community. Today I'm speaking right now from my experience all throughout communities. So here and now in the city of San Diego, we know Mayor Gloria has uplifted and invested a new department to address homelessness. This is something new. it's very hard for one person to help lead all the initiatives, do the internal and external coordination. And so with this new department, some of the things that we're looking at is leading from first and foremost with the values of compassion-driven approach that Dr. Williams had so well reiterated in the beginning. Oftentimes throughout now my experience in Southern California, I've seen that there's many ways that jurisdictions have responded to homelessness. Oftentimes it's leveraging from your police department. Other times it's actually creating capacity. And that's what Mayor Gloria has done. He's created capacity through the investment of a department that is going to be really doubling down and taking a look at how we are responding in our ecosystem of programs and services. To that end, we do have a great partnership that I walked into. San Diego is very special. You have the Regional Task Force, which is the COC, who has been working diligently to help establish a foundation of partners. And of course, delineation of funding from the COC perspective. And then the county recently created their new Department of Homeless Solutions and Equitable Solutions, I believe. I know I'm not pronouncing it right, but it is the Office of Homelessness and Equitable Solutions. It also integrates refugee and immigrant responses. Really excited that the county has an office and a collaborative approach. And of course, Chair Fletcher and Mayor Gloria have been working closely to enhance the collaborative work, which we are looking forward to establish into tangible programs and services, boots on the ground. And then the other thing I wanted to say also is that I've noticed in the city of San Diego, there is definitely residents and businesses who are very, very willing to respond to homelessness. They care. Our constituents care about the issue. Our businesses, I know there's the Lucky Duck Foundation that also in terms of a private sector, also even UC San Diego right here, all of our educational institutions care and want to respond to the challenges and want to be able to create a better quality of life. And these are some of the things that was my first reaction coming here. I will also say that Mayor Gloria has really led many initiatives thus far. One of the things he has done is, prior to me coming on board, enlisted the help of Matthew Doherty, who is a well-renowned expert in the field of homelessness nationally. He used to be the executive director of the United States Interagency Council on Homelessness, working with the federal administration, and now also working obviously with the National Alliance to End Homelessness. So he now has his consulting, and we have been working closely. To that end, there has been a report that was published prior to me coming on board in July on the state of the city's homelessness response and the recommendations that need to help move forward. Some of these recommendations were the internal coordination and, of course, the external coordination, but also building capacity and expanding shelter and outreach and looking at that people-centered approach. That is really the implementation that this department is seeking to strive. And one of the things I wanted to mention in the fiscal year 2022 budget, the city, with the help of Mayor Gloria and City Council, did go ahead and resolve $10 million in the creation of the Homelessness Strategies Department, along with $7 million for the struggling substance abuse addiction population and mental health comorbidity. Another $1 million to expand coordinated outreach with people, PATH people assisting the homeless. Another $1 million for rapid rehousing programs to help 100 households, including rental subsidies and case management. As you know, Mayor hired me in August, and since I've been hired, I've hit the ground running. One of the most important things to note is that we work very closely with the San Diego Housing Commission. And the San Diego Housing Commission is a public housing authority, but it also does a lot of incredible work in terms of addressing the front end of homelessness. And one of the things prior to me coming on board here was also the downtown outreach that was a coordinated effort in July. Over 476 clients entered into shelter, with over 700 being referred to county behavioral health. Almost 151 COVID vaccines were provided. And so this multidisciplinary approach of all of our provider bases including PATH, including Father Joe's, including Alpha Project and the city and San Diego Housing Commission, and our HOT teams, our homeless outreach teams with the police department, really came together to help with mental health and social services and get folks housed. So I say that to say that it is always a team effort. I get the honor to lead this new department within the city and work in Mayor Gloria's office to address homelessness, but truly we rely on our regional work to make sure that our collaborations are helping create outcomes. I'll also say one of the things that we've been working in is the establishment of the community harm reduction outreach teams and community harm reduction shelter, as well as safe haven shelters for really low barrier needs, and also for care coordination, for wraparound supportive services for those individuals who are experiencing behavioral health issues and comorbidity to substance abuse. We are also working very closely with the downtown partnership because we've seen some of this play out within the downtown, but we know that it's all throughout the city. So we want to make sure we're making equity also at the forefront. And speaking of equity, one of the things that this department is also wanting to work closely with the COC is a Black ad hoc group on San Diego's experiencing homelessness or lived experience as well, but then also just the Black and Brown community who are stakeholders within this. Also looking at senior communities, LGBTQ+, HAPWA, really making sure that there's an equitable response to addressing homelessness, and access is always a priority. So that is a partnership, the community harm reduction teams with the county, and we're really excited to get that the shelter live and launched here in the next couple of weeks. It takes a lot. Alpha Project will be the provider, and the San Diego Housing Commission has done a great job in working to execute the contract and staff up and build up with Alpha. The city obviously has a site. It's an old Pier 1 site, and it is going to be helping about 44 to 50 beds. And then we're really looking forward to do a phase 2 with the safe havens. All of this takes a lot of planning, and it takes a lot of approval of board meetings and approval of council meetings. And so I think it's really important for the public to know that things are happening. We hope to happen at a quicker pace, but there's a lot of dedicated people who are passionate to make sure that we're all working together. So looking at some of the things that we've been working on in September and October is one of the things I realized is that there's not enough provider bases in San Diego. San Diego is the second largest city in California, in California, and I believe, 8th in the country. And so we have to make sure we position ourselves to have a robust response system. Our providers have been spread thin, and they've been doing an amazing job, but we really need to make sure that we expand our provider base. So within 60 days of coming here, I was able to work in this department, and really Mayor Gloria has empowered this department to help create new initiatives. So one of the initiatives is the expansion of a provider base for outreach here called CityNet. CityNet is a outreach provider nonprofit that has social workers and case managers, and they are new to San Diego, but they have been in the field of homelessness response since 2005 and service all across Riverside and Pass, Orange County, and Santa Barbara and whatnot. And strategically, the outreach provider CityNet will be working in partnership with Caltrans to address the targeted and focused areas on the highway passes. There was a press release done a couple of weeks ago in regards to this because it really highlights the partnership that the state of California, the city of San Diego, and our nonprofit provider have to ensure that while the highways need to be part of Clean California, we are putting homeless outreach at the forefront and really moving from a place of human-centered approach. So rather than just cleanups and moves around, what we're aiming to do is ensure that people are being offered services. And we're really excited to say that CityNet has hit the ground running. And just yesterday, I saw a success picture of an individual who had accepted shelter over his encampment at the 5 freeway overpass. And we will be uplifting these stories from a qualitative perspective as well as a quantitative perspective. Mayor Gloria's comms team has been tweeting out many success, and we will also be uplifting these stories in our new homepage for homeless services within the city. So I understand that the complexities of capacity building, the expansion of shelter and outreach, making sure we're communicating to our community and being transparent, and then also leading from a place of sustainability. It's really important to have sustainable outcomes. That's why we always look at affordable housing as the major outcome. Obviously, accepting shelter is great, outreach is great, but housing first is the model that the city is aligned with, and it's the model that we are moving to lead with. As you know, there's permanent supportive housing projects in the Kearney Mesa for persons experiencing homelessness that have been led by PATH and Father Joe's. We are going to be continuing those permanent supportive housing, but we're also looking at the state funding for Project Home Key, which is additional permanent supportive housing, capital acquisition, working with the San Diego Housing Commission to ensure that more people are not only getting off the street into shelter, but also having their own very key that they could lock and be connected to supportive services. And so that has been really the major gist of what's been happening here. Some of the other major initiatives, in addition to the Caltrans and CityNet partnership and getting people off that, is PATH doing a great job with the rapid response team in the city, making sure that folks are being connected as soon as possible. We have a Get It Done app where folks can report any concerns around homelessness, including encampment, and we're working through that with our performance and analytics teams. In addition to that, definitely there has been more than $103 million in rent and utility assistance that has supported 12,000 San Diegan households. We've done a great job with rental assistance with the Housing Commission. And in addition to that, Mayor Gloria did visit DC back in September and met with Secretary Fudge and advocated for additional funding and the use of our American Rescue Plan of being able to rehouse committing 2,065 households and 1,053 new units of affordable housing by December 31st, 2022 in partnership with San Diego Housing Commission. So this Housing America initiative is something that we're certainly definitely going to strive for. And Mayor Gloria has done really led from a place of wanting to uplift this administration, uplift this department to really look at how we can make sure that not one person is left behind. And so really beginning to look at data from a perspective of not just numbers, but people who are actually getting connected and not recidivism of homelessness. Some of the programs that we have in the city that was introduced to me when I came here, it's been 3 months now, but all that to say, it's just been 3 months, but I could see very quickly that there's been quite the system here and we're working through it, is the safe parking program for persons experiencing homelessness that have a car, family reunification with downtown partnership, rapid rehousing, shelter expansion, like I said, prevention and eviction and rent and utility assistance. And then also part of the $10 million of the ARPA funding was also setting aside funding for the San Diego College along with San Diego Housing Commission for helping a peer support program, certification program for students who want to be aligned with homeless service response, because we know that there is a provider-based issue across not only California, but the nation. Lastly, I will say, working in collaboration with the county, there's also, in addition to the C-HEART, the MCRT, to confuse folks, it's the Mobile Crisis Response Team. And the Mobile Crisis Response Team is managed by Telecare through the county. And the county crisis response team will be 24/7. And we're really excited that this response team is a mobile crisis response team for anyone, but also for people experiencing homelessness. And so it really speaks to the duality of the homeless response as it relates to mental health and triaging the most vulnerable. In addition, one of the other things I wanted to mention is making sure infection control is still a priority with COVID. There was Operation Shelter to Home last year at the convention center. That was a great success that brought all of the providers together and housed many individuals. And so we saw that cohesive alignment is something that we want to continue with, and really helping people get permanently housed. So with that, we do know that there was a Shigella outbreak recently for persons experiencing homelessness, and we've been working very closely with the county department. Obviously, through public health, we've been notified it's not as serious, not to say as serious, but not as dangerous as COVID, but certainly with people who may have compromised health or immune systems, we want to make sure that there is that connection. So that's all on the external. Now pivoting to the internal, this department has a programs division as well as a budgeting and monitoring division that we're going to uplift and empower to begin to really work with our partners to double down on every single dollar, making sure that it's well accounted for to address homelessness. And that's definitely something that we want to do as good stewards of public service. But the other piece to that is I'll be hiring a deputy director and an unsheltered housing manager in the department and expanding the department so that we can provide more technical assistance and capacity for our partners in being a funder, but then also a great partner. And then lastly, but the most important, is really working with lived experience persons and elevating and leading with that. As you know, best practices is, being in the university, it's what we strive for. So really listening and hearing lived experience person. I'm sure I've missed quite a few things, but that is sort of the nutshell. And I'm happy to answer any questions. And it's 1:00 on the dot.
Wow, that was very impressive. Thank you so much for giving us the lay of the land, both externally and within your own department. Thank you so much. We do have quite a few questions kind of building up, and I would encourage those on the call right now, if you want to go in, and if you don't want to add a question, if you want to put an asterisk next to a question that you really like, that's how Kate and I are kind of monitoring how we're going to be doing this. And some of these questions, Ms. Kaka, some of them are just asking you to maybe give a little more details about something you mentioned. So the one we're going to start with is thinking about best practices. And given your wealth of experience in Southern California, are there best practices that are being done elsewhere that you would like to see San Diego do? And or are there best practices here in San Diego that you think we are kind of the leaders with that others might want to be following us on?
Yeah, that's a great question. So best practices, yes, it has been something that I have seen in other communities and also here, and that is housing first. Housing first works. It is important to understand that a person who's unhoused and then gets housed is no longer homeless. And simple as that sounds, it is something where stigma still is out there, stereotypes are still out there. I've seen persons who have been unhoused and received a key to their housing, whether it is to a permanent supportive housing building or a voucher, and are still perceived as a person experiencing homelessness. Is really important to make sure that there is that delineation. So housing first works. And so sustainability, making sure that homelessness is one time and brief and not a pattern that is throughout a person's lifetime. We know that the more a person experiences years of homelessness, the more out in the climate, out outdoors, especially unhoused, outdoors and not in shelter. Shelter also has certain challenges, but being outside is going to quickly cause a ripple effect to the health and ripple effect to mental well-being. So it's really important that housing first is part of that. Other best practices is definitely outreach. Outreach is really important. And as you know, Mayor Gloria has invested funds in outreach, and this department has contracted many housing providers, most recently, like I said, or outreach providers, most recently, as I mentioned, with CityNet, and making sure that there is providers that are not spread thin and working together. Another best practices is also shelter. I mean, shelter should not be the end. It's only an interim, but it is important that there is an acute response as well as a chronic response. An acute response saying, we know that housing can take sometimes a while, especially if it's affordable housing. It shouldn't, and we look to help nip a lot of the challenges and see how we could expedite the process, whether it's IDs and the housing authority, documentation and things of that nature. But it is important that there is a critical time intervention, which is also a best practice. Outreach workers also use best practices that we want them to use, like motivational interviewing, social work skills, multidisciplinary approach. As I mentioned earlier, the C-Heart team is going to be a multidisciplinary approach. You've got a team of social workers, nurses, folks that could really help connect and establish rapport. And same thing in shelter. It should be dignified with meals and showers, and it should not be something where it's a demeaning experience. It should certainly be an uplifting experience, and that's what we strive from the provider basis. And then, of course, also the most important, as I mentioned, permanent supportive housing, affordable housing. That is a best practice that ends homelessness. And then also making sure that there is job opportunities and employment opportunities for persons experiencing homelessness so that they can move towards additional self-sufficiency. And another piece is regional coordination, working with our federal partners or state partners, working to establish a greater system, making sure that the funding is coming, but the funding is also addressing needs and programs we have a great government affairs department that's working at the state level and at the federal level to help cut any issues that may impact persons experiencing homelessness. For example, one example is Section 8 and qualifications and eligibilities and veteran VASH vouchers and things of that nature and eligibility requirements. So those are some things that on a high level, what best practice looks like, but absolutely housing first, and also listening to lived experience persons, and also making sure that there's equity as it relates to people of color or gender equity, age equity, especially in the access of care.
Thanks so much. And given that this program is here at USD around Homelessness Action Week, we definitely want to ask you a question about getting our students, our community members involved. So this is kind of a two-part question. It's what advice you would give to those in the community, both on our campus and off campus, to get involved in addressing this issue in meaningful ways. That's the kind of broader question. And then we had a more specific question about the certification program for students that you mentioned earlier. And there was just a question about you providing a little more details about that if you have any.
Yeah, absolutely. So I could get more details about that second one, and I'll pass it on to you. There's some outcomes as well. I don't have it memorized right now, but I could pass it on to you afterwards. But to your first question, I will say that we have a shortage of provider bases, I think, all across, especially with COVID. And so I think, really leaning on students who have an interest to do this work. This work is hard work. Working within, every work has its challenge, but I've heard so much post-secondary trauma from direct service providers. there's a lot of back and forth. There's a lot of establishing rapport. There's a lot of help navigating. And so one of the greatest challenges that we have seen is that there is a lack of provider bases. So to students who are interested in the field of homelessness, to students who are interested in the field of psychology, social work, I would encourage you to continue to go on that path, because we need people to help people. I consider it essential workers, right? And that's how during COVID, many of the outreach providers for homeless outreach, they were still out there. They were still making sure that people experiencing homelessness were able to quarantine into a shelter, right? Like a lot of people, or in their own tent, a lot of people who aren't housed, we were told to, go ahead and quarantine. What about persons experiencing homelessness who don't have a home? So it's really important for that. The other thing that students can do too is, for right now, in terms of a tangible time, is my understanding is the continuum of care will be putting out the point in time count, sign up, and volunteering. I would encourage you to do that. It really gives you a wonderful opportunity to go out and interface with people experiencing homelessness and do the count, but also it allows you to learn about how the system works and really engage and see where that passion lies. And then, of course, volunteering is always great with our provider bases. I know all of our provider bases have a website. The San Diego Housing Commission has a website for the provider bases as well, where it puts out, our website is going to also have that. And it's important to see how, there could be potential donations, sometimes specific shelters need specific things. I know that I had an opportunity to go to Father Joe's PMC shelter, and there was this beautiful little I'd call it a shop, but a donation center. And it actually had kids' items because they do service children. And so that was sort of humbling to see that there were new shoes and new kids' items. And people are experiencing homelessness. They need clothes, they need shoes, they need hygiene. So things of that nature. And then, of course, donations, as always, is something that will help. But also, I think one of the most important things is education and passing on that education, passing on that, what we're trying to do here. Mayor Gloria has changed the status quo in San Diego City on how we're addressing homelessness. We're really addressing it from a people-centered approach. And that means understanding that people experiencing homelessness are people. And there's a lot of misunderstanding about stigma, drug addiction. People choose to do this. I will say this, I don't think anybody, and this is an educational group, right? I mean, you're at a university. When we were in the 5th grade, did anyone raise their hand when the teacher asked, what do you want to be when you grow up? Did anyone say, I want to be a homeless person, right? Nobody says that. There's things that happen. We've said, we want to be doctors, or we want to be lawyers, or teachers, or this or that, or, so things happen in people's lives. And I've seen people who have had car accidents, who were working, who can no longer work, had to take a medication, got addicted to that medication, or people were on the brink of divorce, they lost all their assets, or the person who has real severe bipolar personality or schizophrenia or whatnot, or even depression and anxiety, and they simply just can't wake up and, do what needs to be done to be self-sufficient. To people who actually have unfortunately touched the criminal justice system and have now lost a lot of trust in the system and the willpower to move forward in helping themselves. So there's just a lot to that we can collectively and collaboratively provide support.
Yeah, thank you for that. We have some pretty knowledgeable folks in our audience, Ms. Kaka. So this question I'm going to ask you, I realize there might be some of these where you might be like, well, I might have to get back to you on that to get some information, just to give you a fair warning. This question asks about the provider base. And it states, Governor Newsom recently denied a bill that would have reimbursed street medicine teams. In light of that being denied, what is San Diego City doing to support street medicine providers?
Yeah, I saw that as well. And that was really interesting to me. So I know the bill that this, is it a student or a professor? I don't know.
Actually.
Yeah, thank you for, and thank you for being so, well vested and knowing it's important that we're well tapped in for advocacy purposes. I've seen this happen in other communities where there's street medicine provider bases. In fact, in Riverside, we actually did go ahead and utilize some of the city's general funds to help create public health outreach response. This is definitely something that I am looking to make sure that there's health equity. Of course, I don't want it to seem that there are programs and services just that I have experience from other jurisdictions supplanting immediately here, right? I've been here 3 months, and it's important to know that we take a good assessment of what's going on, taking a good assessment of what duplication of services are happening. I've been in conversations with the county's public health and beginning to really understand the response system in terms of public health. So that is a very good question, and that is a model that I use many communities, including Skid Row. I would be interested to see what is happening currently here and how we could continue to review. So that would be my answer.
Yeah, thank you for that. And I think for students on the call right now who maybe are just learning about this issue, I know that they're getting a taste of how regional this is, and just the ability for different government offices and nonprofit institutions to work together on this. That in and of itself is a big lift. So thank you for sort of sharing how that's working and what you're doing in your office the last 3 months to kind of make that work. You mentioned in your remarks about the importance of lived experience, and there's a question about what you're planning to do in your own department in terms of giving those with lived experience not only a seat at the table, but a voice at the table. Are you envisioning some sort of way that can happen moving forward?
Oh, absolutely. Absolutely. And I think it's also important to note that lived experience is led by the lived experience person. I actually myself have lived experience from childhood. And there was some article about that I don't need to reiterate. And so you can read that. But my parents did come to this country, and we struggled within the system ourselves. And so I know that with the help of programs and services, I grew up on Section 8 as well. These things help to uplift people to be successful. So it needs to be something that is led by the lived experience as well. So if a person wants to disclose that they are interested and to have lived experience, then absolutely, certainly. But I will also say that we are always seeking all forms of diversity to help uplift the new department and in this administration. I will say that equity is woven across. Mayor Gloria has also appointed a chief equity officer within the city, Kim Desmond, and I'm working closely with her as well to see how there could be specific intersection of equity through all of our programs and services. One of the other things I wanted to also mention is that the city's boards and commission, most recently a youth commission, was appointed, and a lot of our funding for youth is also importantly noted in state grants. And one of the youth is also lived experience as well. So while it's not necessarily in the department, it is also within the mayor's office and throughout the city.
Great, thank you. You also mentioned housing first as a best practice, and there's a question. I'm going to reframe it a bit by I hear from a lot of students who simply say, well, why can't a city just build more low-income housing? Like, we need more housing, so why isn't it getting built? I'd like to hear your remarks on, I don't know, the challenges and opportunities that city governments have to address the severe housing shortage that really is one of the roots of our homelessness issue.
Yeah, absolutely. And, affordable housing is something that, so when I look at the homelessness complex, there's the front end services, and there's also the sustainable. I've in my career have had the honor to lead a lot of the front end. So affordable housing also has intersections of policy. So I really lean towards our director of policy to help us with this as well. And we'll be putting out additional information. But one of the most important things is, let's start off with NIMBYism first and foremost, not in my backyard, right? Going back and taking away and looking at some of that stigma. It's really important, as I mentioned before, educating. I've been in communities where people have been housed in affordable housing and are still considered homeless. And that's not true. That's your neighbor, and that person, is no longer homeless. Another piece to this, Dr. Williams, is also looking at site RENA numbers. I understand that there's developers who also have specific caps. And then in addition, how to look at ongoing supportive service dollars. So there's many, many complexities in the expansion of affordable housing from the developer perspective too. And so I would say that it is definitely something that needs to be done, but it's also something that just housing shortage in general, and the market and the vacancy rate is not, even with Section 8 vouchers, even with when you have an actual Section 8 voucher to go seek and work with landlords, that's also an issue. So, and then time as well. We've seen that it takes 1 year, 2 years, 3 years, 4 years. There's many levels to affordable housing development. So I would say those couple of bullet points is something that we need to look at even more. And then of course the middle income bracket as well. And then also to that, I've seen so many folks who have come through the door and say, look, I make $1 more than what is this necessary subsidy. So how do we go back and take a look at from a policy perspective and from an advocacy perspective to change things of that nature?
Yeah, that's great. And I just want to follow up because you mentioned NIMBYism, which is something that Dr. DeConnick and I and others on this call have been thinking about and doing some research on. And just from your experience, like what has worked in your experience when you go into a local community meeting and there's resistance against a program that's going to help those experiencing homelessness? Have you found that there are certain communication strategies that are more effective than others?
Well, with the consent of a person who has lived experience and with their own empowerment to want to speak to groups of folks, I have seen that being a powerful tool and a powerful narrative. It's really important, as I mentioned before, that it is through the autonomy of the person with the lived experience to speak on that. And I've seen in many communities across Southern California where a person has been able to say, this is the before picture and this is the after picture, similar to, the before and after makeovers, and people will just, wow. And when you see the after picture of a person wearing a suit and a tie and going to work with a briefcase to the before picture, we're literally sleeping on the steps with shoveled hair, not having a place to even get ready to go to work. That has been a powerful narrative. And I have seen that, again, at the autonomy of the person with the lived experience to share his or her story or their story. So I've seen that as very important. Also, education in general, that permanent supportive housing, affordable housing, in the long run, housing first in the long run saves money. It saves funding, especially for high utilizers of the hospital system. This is something that recuperative care is also a big piece. It's a project where you have a placement of ongoing continuity of care for those who have been in the hospital system so that when they're discharged, they could be looked over by nurses and looked over by case management and connected to housing even further. And I know that there's a lot of reimbursement coming from in January from California Cali in terms of helping to support beds and for those experiencing homelessness who have been discharged. So you can look at a system of care that, if we create a system where folks can have access to care, they wouldn't necessarily be high utilizers of an acute system that might create more issues. We've seen people who are experiencing homelessness who constantly go to the ER. How can that be stopped to make sure that there is ongoing health care in a stable environment called a home?
Thanks so much. And yeah, thank you for answering so thoughtfully and so succinctly so that we can keep asking you questions. This is wonderful. The next question that seems that folks want us to ask have to do with the role of law enforcement with respect to homelessness. This has been a discussion, as you know, that is happening not only in San Diego, but across the country. And most recently at the PolitiFest conference, there was a really good panel on this issue. And I'm just wondering, what's your opinion on what needs to be done with respect to the issue of criminalization of homelessness in San Diego?
Yeah. I'm privy to what you just mentioned, and also most recently, the city has received some articles and whatnot in the media regarding this. So I'll tell you this: it is important to understand that people experiencing homelessness come from all walks of life, and just like we all come from all walks of life. Mayor Gloria, this administration, this department, myself, this is why I joined San Diego, is because we are leading from a place of outreach, engagement, supportive services, the human-centered approach. That is very critical and that is very important. It is important to also say that if people are in danger, then it's a public safety and health issue. And that's not a get out of jail free card. It's important to provide people with services, but I'll be very transparent to say that people experiencing homelessness on the street, they also experience violence on the street too. And so it's important that whether it's from another person experiencing homelessness or whether it's just from anyone who is not, whatever the status is, there needs to make sure that people are safe. And so that is really the public safety piece of it. I do say that there's two populations that are always on the streets, right? There's the unhoused population and police department. The PD, they're always on the street. So it is important to provide them with tools to be able to help bring people into shelter, because oftentimes that's leading from a place of engagement, a place of outreach. So we do have the HOT team who is empowered to provide shelter. That's really important. But to that end, we have 4 or 5 different agencies who are providing outreach. So it's important to say that we have been able to have everybody offer outreach first and foremost to people experiencing homelessness, and we hope that they access those resources.
Yeah, thank you for that. Thank you for that very much. There's a couple of questions in the document about wages, just about the high cost of living in San Diego, and a recognition that might be considered one of the root causes here in San Diego, just in terms of what the living wage is and what people are actually earning. And I know this may not be within your jurisdiction at your department necessarily, but what are your thoughts and what have you learned from other jurisdictions in Southern California about what cities can do about this wage gap between what people earn and what they can afford?
Yeah, California is a doozy, right? I lived in Minneapolis for a few years when I was in grad school, and I remember my rent was $700, and it was a 3-story townhouse, and I had the works, and it was in a safe area, and the cost of living and my income was not comparable, So California's wages and the cost of living is definitely something that not only people experiencing homelessness have dealt with, but also people on the brink of homelessness. We have folks that are at risk that are living paycheck to paycheck that has come to light, especially during COVID. So I think in general, it is really, really hard to be able to have a cost of living match the actual reality in California. And so one of the things that I know that's been very creative that I've seen in terms of some of the outreach workers is they've been paying their outreach workers a little bit more to help do the work, to help meet the growing needs of people experiencing homelessness. I know that there are programs that are through Goodwill, not necessarily here, but I know that there's programs, and I have to look into it here, is programs that help provide subsidy and stipends to persons experiencing homelessness as a job pilot program. So things like that could help begin the trajectory of stability is something that I really welcome.
Wow, I did not imagine that we were going to be able to get through so many questions with so many thoughtful answers. So we're just about at time, but before we say goodbye and Dr. DeConnick says some final thoughts, I wanted to ask you, is there anything we didn't ask you? Is there anything you just wanted to add as a closing remark before we end the program?
Oh, I very much appreciate that, Dr. Williams. I want to say thank you so much. And while Mayor Gloria couldn't be here today, he has really changed the trajectory and the status quo of homelessness and empowered an entire department so that it's a collective work where we're working with our regional partners. And I just want to say thank you for bringing this to light. And I hope that the mission continues. Please continue to know that you can access and learn about services supporting the work that the city is doing via our websites, the Get It Done app, and then also really supporting the work that we're doing long term.
Awesome. Well, I'm going to chime in also just with a word of thanks, and maybe we can all offer our virtual, or if you're on the camera, our little clap emoji or whatever we want to do. It's just been so wonderful being able to be in conversation with you today. And like Dr. Williams was saying, we're so grateful for your patience and your thoughtfulness in answering all of these questions and helping us think about collectively, like, where do we go as a community moving forward? And it really is a community effort. So your emphasis on collaboration, your emphasis on the human-centered approach, I think really resonate with the way we're thinking about things at USD as well.